Hey everybody, Dr. Martin Hart here with Keystone and Microbalance Health Products. Talking tonight on mold and MCAS 101, answering questions tonight. We got a lot of them. We're going to talk a lot about mold, mast cell activation, talk about histamine intolerance, parasites, all sorts of good stuff. So we're excited to talk about that tonight. I do have to start with a little disclaimer. Tonight's talk is for informational purposes only, not intended to treat, diagnose, or cure a medical illness. It's for you to grow and empower yourself with. So tonight's topic, mold and MCAS. What is MCAS, first of all? MCAS, MCAS, stands for mast cell activation syndrome. Okay? Mast cell activation syndrome is all about our immune system and inflammation. So mast cells, they're a part of our immune system. It's used to fight mostly parasites, fungi, a little bit of bacteria. They degranulate, which means when they're attacking something, they kind of puff out and release their contents. Okay, those are mast cells. A lot of times are actually a big link, though, between our neurological system and our immune system. So mast cells kind of like this coordination between the neurological system, or the central command system, and our immune system, our military units, if you will. And so mast cells are the big baddies who fight major infections. So they fight big bacteria, larger sized bacteria. They fight parasites, because parasites a lot of times are too big for the rest of the immune system. And they fight fungus, okay, mold, fungal overgrowth, candida, yeast, things like that. So their job is to fight those things. And so mast cells, though, can get over when they're triggered. We might have a flush, we might turn red, we might have itching, we might have hives, nausea, vomiting, all sorts of stuff. Why? What are mast cells releasing when they do that as part of their military ammunition, if you will, to fight those things? Well, mast cells are releasing, number one, histamine. Okay, we can think of histamine like with antihistamine. So when we're thinking of allergies, okay, or food sensitivities, or like or seasonal allergies, hay fever, right? So they release histamine, but they also release other inflammatory cascades like prostaglandins, leukotrienes. Okay, they release actually serotonin. That's kind of interesting, isn't it? They release other factors like stress hormones. Okay, they can release all of these different factors to help our immune system fight and get rid of these critters. So they can create that huge inflammatory event when they release. Now, we need that when we're consistently fighting an infection. We want to get rid of the bacteria. We want to get rid of those parasites, right? Maybe we went on a trip, we ate some food that we shouldn't have, got a little bit of parasite in our gut. Our mast cells are going to help clear that out. That's their job. So as part of this live as well, I want you guys to know there's a blog associated with it. You can check that out on Microbalance's, one of their websites, sinusitiswellness.com. There's a whole blog we wrote on mast cells and histamine intolerance you can look at. So what are some of the other jobs for mast cells? Okay, they fight infections. They aid in communication with the immune system. So like I said, they partner with the neurological system, command central, and they partner with our immune system, the military. Okay, they regulate and control inflammation. It supports detoxification. So if we need to help clear things out, okay, the mast cells can do that. Hey, thank you. I appreciate that about the article. Okay, so they can help you do that. And so a big thing they help us clear out is venom, right? Now, you might think venom, snake bites. I don't get venom that often. Oh, okay, but what about mosquitoes? Their venom. What about red ants? Their venom, right? Anything that bites you a lot of times has venom in it. Okay, so we could look at that as that mast cells help us detoxify or clear out those venoms from those bites. Helps to balance blood flow and blood pressure. Helps to mediate pain. It's really big in pain regulation, especially in dealing with inflammation. So mast cells with the leukotrienes, prostaglandins, those all regulate pain on the big ones. And they aid in wound healing. So when we have wounds, mast cells help us heal on that front. They have a lot of jobs that are really important, okay? So we need mast cells on that front to regulate all of that. But what happens when it gets out of control? That's what we call mast cell activation syndrome. Okay, so mast cell activation syndrome is either when these mast cells are getting activated too often. Okay, they're getting triggered too easily to release all those inflammatory compounds, the serotonin, the histamine. It's happening too often. Or you have too many mast cells and then they're getting triggered, maybe not always too often, but they're getting triggered more because there's just so many. Okay, and so that can be called mastocytosis. But either way, still results in MCAS or mast cell activation syndrome. So on that front, that could be a big deal on there because we're going to run into problems when the military is hyperactive in our system. So what does that look like? What does it look like when you have an overactive mast cell, you're getting the MCAS reactions? Well, look, first of all, it looks like histamine overload, or it's called histamine intolerance. So histamine intolerance is when we just have too much histamine overall. Mast cell activation syndrome is when we have too much histamine, yes, but also all these other compounds are getting released all the time from the mast cells. So too much histamine could look like flushing of the skin, hives, allergies, anaphylactic reactions. Could look like insomnia, loose stools, cramping, depending on where it's at. And so why, depending on where it's at? Well, the mast cells are in different regions. They're in the brain, okay? So we can get brain fog, headaches, fatigue. We can actually act a little bit psychotic when the mast cells are really too overacting in the brain. We get rage because histamine regulates our neurotransmitters, okay? And it regulates inflammation. So brain inflammation results in neuropsychiatric symptoms, okay? We have mast cells throughout our whole digestive tract, the throat all the way down and out, okay? Stomach, intestines, the whole thing, okay? Covered in mast cells. Bladder, tons of mast cells. Lungs, mast cells. Skin, mast cells. Arteries and veins, mast cells, okay? Lots of them all around. So depending on where they're getting overactivated, can tell you where your symptoms mostly happening. So they're getting overactivated in the lungs and sinuses, you're going to have more congestion, respiratory, asthma type symptoms. In the arteries and veins, maybe more low blood pressure, more inflammation. Low in the GI tract, you might have more bloating, nausea, vomiting, loose stools, okay? Any of those can happen. If they're happening more in the bladder, you're going to have bladder pain. This is where people get chronic UTIs or interstitial cystitis, even though they don't have a culturable infection, because it's not a UTI. It's actually inflammation or mast cell degranulation or MCAS in that bladder, okay, happening. And so wherever those are at, they're going to create their own symptoms, okay? Skin reactions are a big one. These people are a lot of times very easily flushed, easily red. If I work on them topically, they get red right away afterwards. So that's a big one that starts happening on that front. A lot of mouth burning. Burning is a big one. Skin burning, burning inside, stomach burning, burning in the eyes. All of these things are big mast cell activation or histamine symptoms as well that you can have. So those are big ones to look out for if you're dealing with it, okay? Now, what are some other things that happen? Low blood pressure we talked about, because what is its role? What does histamine do? It dilates the blood vessels, okay? It makes things more leaky and permeable so the immune system can get in there. But that also means leaky gut. That also means leaky membranes throughout the body, okay? Histamine and mast cells help regulate your sleep-wake cycle. So if histamine's getting ramped up, you can have insomnia even though you're agitated, or your night and day cycles can be dysregulated because all this histamine is flaring in the brain and nervous system. It stimulates your neurons. So more pain, more agitation, right? Faster thoughts, more anxiety. That can all happen. You can have smooth muscle contractions. That's what histamine does. That's when you get a lot of cramping or you get a lot of loose stools because all those smooth muscles are getting cramped down. Boom, you're going to flush. Histamine's also really important in how you perceive pain. Okay, so you're going to be more sensitive to pain and have more pain overall. It helps to regulate the rest of our neurotransmitters in our brain. So it helps to balance serotonin, dopamine, norepinephrine. Okay, it regulates all those. So when histamine's out of balance, everything's out of balance. How often have you, if you're dealing with mast cell activation and histamine, been told you're depressed, you're anxious, you're put on antidepressants, you're put on benzodiazepines because they're telling you, hey, you're just stressed, you're just anxious. Well, yeah, because your whole control center is totally out of balance. The mast cells and the histamine are totally dysregulated in your brain, and you can't function with that, right? It doesn't work that way. The other biggie is that mast cells and histamine regulate stomach acid. So you might get heartburn because all this histamine release is overstimulating stomach acid. It's one of the few times, I see too much stomach acid. I'll answer. I got another question. It's a great one about colonization. I'll tell you about that in a second because that's really important. And so the other big thing is mucus and congestion. So my nose is always plugged. It could be sinusitis, but it could also be mast cell activation histamine because it's going to create all that extra mucus and inflammation there, right? So a lot of times if you eat something and you immediately have some mucus, you know you're probably sensitive to it because your mast cells and your histamine is reacting. So you've got all these symptoms, maybe they're showing up because your mast cells are overactivating, they're over-degranulating, they're releasing histamine, they're releasing prostaglandins, leukotrienes, tryptase, they're releasing all these enzymes to break things down, they're releasing serotonin, okay? And so they're dysregulating that system. Now, why do they get dysregulated? Okay, partially because if you have some of these infections, we talked about bacteria, parasites, fungi. What's fungi? Mold, yeast. Okay, if you have these things and they're chronic, the mast cells are going to continually get triggered, and then getting triggered becomes easier and easier the more they're triggered. And so now they're much more sensitive. It doesn't take as much to trigger them. That's a big cause of mast cell activation syndrome. You've got a chronic bacterial infection, a chronic parasitic infection, or a chronic fungal overgrowth that's driving this. But what's the number one cause of mast cell activation that I see in my practice is mold toxicity. Wet building syndrome, chronic inflammatory response syndrome, or mold illness. Okay, that's the number one thing, because that immune system, when it gets those mold spores and mycotoxins in, is trying to clear it. And so it's going to activate that mast cell pathway to do it. Okay, but if it's just once, you get one mold hit, like you go into a moldy building, a wet building, and you get a mold hit, your mast cells activate, you get sneezy, you get congested, you get the whole thing, you sneeze it out, you clear it out, they do their job. But if you're constantly getting exposed, you live in it day in and day out, or you work in it day in and day out, or it's colonized inside your sinuses, right? Those mast cells are getting exposed, triggered all the time. Boom, they're getting triggered. Now here's what's even harder about that front for those people is mast cells have a receptor, okay, on top of them that receives for corticotropin releasing hormone, CRH. What's that mean? Corticotropin releasing hormone is the hormone that comes from the brain that triggers your adrenal glands that you're in a stress response, that things are stressful. So that means stress will trigger it will trigger the mast cells, okay? And then those mast cells release all those chemicals, those chemokines and cytokines and all those immune chemicals that release inflammation, and then they re-trigger CRH. So that means they re-trigger the brain's response to stress. And so that means the stress will trigger the mast cells for you, and then the mast cells will trigger more stress. It becomes a nasty spiral, which is why you see some people with MCAS have such a hard time regulating their emotions, and they get in these rages that they're difficult to be around. Everybody's like, chill out. And they're like, I'm trying. I promise. But their mast cells keep triggering that response over and over and over again, okay? So not only maybe are you living in the mold, but now you're more sensitive to stress. And so you're more sensitive to stress, and the stress is triggering it. So what I see a lot of times also with my mast cell cases is they're already dealing with trauma and stressful situations, maybe CPTSD, complex PTSD, and they're already dealing with that, so they're more sensitive to it. And then the situation itself they're in, they're caught in mold, they're having all these reactions, that's stressful, and so it's making their CPTSD worse, and their CPTSD is making their mast cell worse, and it becomes this nasty thing, but then they get stuck on benzos and antidepressants, and it's never going to fix it because it's never really dealing with the real trigger, which is the mast cells, which are probably really being triggered by mold or parasites, right? Atomic Laughter, you can totally essentially be allergic to stress for these folks, unfortunately. Now, it's totally workable, okay? It's a totally treatable situation, but in the midst of it, yeah, you're essentially allergic to stress, okay? And so not that means you need to totally run away from it, but you need to work on managing it and mitigating it as best as possible. Okay, and so why sometimes some of these folks who are dealing with these reactions, because what are you reacting to? You're reacting to scents, you're reacting to smells, you're reacting to things on your skin, the foods you eat, okay, the environments you're in. Sometimes why is it worse than others, right? Why can you eat maybe a small amount of one food one day, and the next time that same avocado, boom, triggers a huge reaction, okay? And you're having a meltdown in the middle of a restaurant, you don't know what's going on, you just got to get out. Got to go. Got to get out of there, got to take your rescue meds, got to do whatever you got to do, you got to get out and go. Why? Maybe your spouse is like, hey, we just ate here last week, what's going on? And you're like, I don't know, I ate the same thing. But your load, what's your histamine load at that point? Because you can eat things that have histamine in them. Avocados already have histamine in them. Okay, so if your histamine load was lower, right, you didn't have as much exposure to histamine or mast cell triggers that time, you maybe didn't eat as much histamine, high histamine foods, and so your histamine load was lower, and so you were okay, your body could adapt. We have enzymes that break these things down, DAO, H&MT, right, histamine N-methyltransferase, diamine oxidase. These are enzymes that break down histamine. There's other enzymes that break down the other prostaglandins and things that mast cells release, right? We could break down serotonin, all of that good stuff. But then the next time you go in, you were stressed. You'd been eating more histamine foods. Okay, maybe you've been exposed to more pollen. And then boom, you have that avocado that already has histamine in it. Your beaker's overflowing, your mast cells are flaring, your histamine's going, and you're reacting at that moment. That's why it seems inconsistent. This is why doctors a lot of times will shun folks who are dealing with this, is because it's inconsistent. So it must be where? All up in your head. Okay? No, it's not in your head, it's in your brain. All those mast cells and histamines flaring in your brain causes inflammation. Yes, so the mold mast cell connection there on that front is the mast cells. When that mold and mycotoxins show up in the system, you breathe them in, maybe you eat them in the food, and your immune system tries to clear them with the mast cells. That's their job, okay, to clear this stuff. They're to clear parasites, bacteria, fungi, mold spores. It's to clear it out. And so they're doing their job. The body's intelligent. It's doing its job, but it's getting triggered too often. If you're in toxic mold, you're getting massive amounts of these mold spores. It's not normal amounts. People tell me mold is everywhere. It's everywhere, but that's a logical fallacy. High levels of toxic mold is not everywhere, okay? The earth does not have high levels of toxic mold in areas that humans would live and we would thrive in, okay? Wet buildings, there's sick buildings. We're living in sick buildings a lot of times, and so we're getting high levels of toxic mold at levels we can't deal with. And so the immune system is saying, keep going in, troops, keep firing, keep blasting. This stuff is not stopping. And so boom, you're getting all these exposures and you're getting all these mast cell triggers because that mold is coming in over and over and over again. And so when this is happening, we've got to do a couple of things, okay? So where are we at so far? We've seen some of the symptoms of mast cell and histamine intolerance, right? We know it can look like allergies, respiratory distress, anaphylaxis, food reactions, bloating, hives, skin reactions, okay? It can look like alcohol intolerance, food intolerances. It can look like multiple chemical sensitivity, okay? Any of those things, eczema, asthma, all of that shows up. Sinus, congestion, watering eyes. Oddly enough, sexual dysfunction is a big one. We need histamine to work right for our libido and for our sexual intercourse to work correctly. And so it causes a lot of sexual dysfunction in people. Kind of crazy to think about. It could be related to mast cell activation and histamine. It's your allergies, right? And so we've seen that. We've seen where mast cells are at. They're in your brain. They can cause all these neuropsychiatric symptoms. They're in your throat. They're in your intestinal tract. They're in your lungs, skin, bladder, chronic UTIs. Again, guys, if you're not finding bacteria as a chronic UTI, but you have what feels like a UTI, you need to be looking at histamine and mast cell activation syndrome, because you can have mast cells that only activate in one area. They only activate in the gut. They only activate in the brain. They only activate in the lungs. They only activate in the bladder. So you got to look at it like that, okay? So we can see why, we talked about why sometimes they reactivate and sometimes they don't. What's your load? What's your exposure been like? We can see, as Atomic Laughter pointed out, right, you can almost be allergic to stress because mast cells have stress receptors that respond to stress hormones, okay? And then they release their own stress response, essentially triggering an allergic response to stress, okay? So can anxiety at night be histamine related, a mast cell related, and I think maybe said, yeah, related. And so yes, because histamine, when it's elevated, it's stimulating. And so when we're overstimulated, we're anxious. So it can cause insomnia. That's why Benadryl makes you sleepy. It lowers histamine in your brain. Okay? And so histamine stimulates it, so what wakes us up. We should have more histamine in the morning so it wakes our brain up, and less histamine at night. But if that's in balance, because we talked about it imbalances your circadian rhythm, well, then you're going to be up at night with anxiety, with insomnia. Okay, so we talked about some of the enzymes that break down histamine. We talked about DAO, HNMT, MAOB. Okay, some of these are actually targets for old school antidepressants with histamine. They worked really well at lowering some depression and especially anxiety because of their histamine effects. You need certain nutrients, though, to make these enzymes work. What do you need? You need copper, you need vitamin C, okay? You need methyl donors, so it's like methyl B12, methylfolate, etc., phosphatidylcholine to make them work, B6 to make them work. You need iron, you need magnesium to make these enzymes work. So if you're deficient in any of these, you can lead to histamine intolerance, lead to mast cell activation. What also depletes these is chronic mold exposure and parasites, right? Parasites will eat Iron, parasites will eat some of these nutrients. They'll block absorption. Mold will create leaky gut or create chronic inflammation, block some of this. For vitamin C, liposomal vitamin C is great. Sodium ascorbate, buffered vitamin C is great. Food grade, of course, we want to go with whole food when possible. Camu, sage palm, yes. But when you need high dose, you just got to get it in. Sodium ascorbate, liposomal vitamin C, great way to go. Okay, other big thing there. Okay, so before we talk about what you need to do with mast cells, which is regulate inflammation, you have to deal with the root cause. Every time, I would say 98% of my mast cell activation cases have two things going on. Number one, they have mold exposure. They've got mold toxicity. They're living in a sick building, probably had it as a kid too, but they're living in a sick building now. You've got to test your house for mold. And so a great way to do that, Microbalance makes the EC3 mold plates. Test your house, test your work environment, test your cars. Cars are always dirty. The mold plates are a great way to do that. Test the cars, test your clothes, your furniture, all of it. If you're exposed to mold and you got mast cell activation, you got to clean it and get out of there. Okay? So you got to do that. And they have parasites. You can go back. We did a 2-part series with Microbalance. You can check their Instagram page on the videos on parasites. Deal with the parasites. Those two things, hand in hand. Boom, mast cell activation. The other big one is Bartonella, but I see that less often. More so mold toxicity, parasites. So check out those lives on parasites. Get some of the EC3 mold plates. Test your environment. Get it tested out. To that. So we see how that regulates those nutrients. But we've got to also detoxify that mold, okay? So Citra drops and nasal sprays, citronasal sprays, get it out of your system, okay? We've got to get that mold out, and we've got to clean your environment, get that mold down, okay? So that's big. And then we got to stabilize inflammation, okay? So there's different antihistamines. We talk about some of these in the blog post, but quercetin's a great mast cell stabilizer. Okay, it stabilizes the mast cell so that it doesn't degranulate as much. Fish oil is really important for this, for anti-inflammation. You gotta be careful. Fish oil is also a little bit high histamine, so you gotta be careful with that. That's a good one. Vitamin C helps stabilize it. There's a couple of things like NAC, stinging nettle. All those are great options to stabilize the mast cell. And totally MVP. It works so well. Stabilize the mast cell and lower histamine. But you're going to be playing that game forever. And there's great also that work okay. Pharmaceutical antihistamines and mast cell stabilizers. But really, I see fantastic results with even the most severe cases with the natural routes too. Okay? And you can stabilize that and focus on inflammation. It's very, very important with MCAS and histamine intolerance. But also, you have to be dealing with the root cause. So if this mold toxicity and these parasites are chronically triggering the mast cell activation histamine, you can stabilize, but you got to get them out of there, okay? Because otherwise you're constantly sending that signal to the troops, and then you're like sending dual signals. So one part with all this parasite and mold toxicity, you're telling the troops, fight. The enemy's here, the enemy's here. And the other part, you're going, calm down. And they're going, the troops. Oh, okay, I'll try to calm down. And so we've got to calm them down while taking away the threat as best as possible, okay? Take away that threat. So a couple other biggies, and actually, so instead of talking about these, I'm going to answer the questions that were presented to us and the questions you guys are asking. So keep putting it in. I'll go a little longer if I have to get all these questions answered. But the couple other things I was going to talk about that actually showed up in the notes and in the questions you guys sent in early. Thanks for sending those. It makes it so much fun on there. So let me see here. I've got one from Blair. Blair says, I have a 15-month-old that has gliotoxins. Gliotoxins are a mycotoxin, which means a mold toxin from wet buildings or sick buildings in his urine. That's one of the ways we excrete them. He has eczema. Yep, common mold symptom. A lot of food allergies. Belly distension. It sounds like mast cell and histamine intolerance. Remediation, healing his gut, and mild detox help his food allergies. 100%. I see that all day long, okay? Getting these things out helps us to reintroduce food slowly. A low histamine diet, though, is very important for my mast cell activation cases. And if you're out there dealing with histamine or this sounds like you, it doesn't hurt to try it, right? Cut out high histamine foods. What's that look like? Cut out avocados, spinach, strawberries, tomatoes. Those are all biggies. Anything fermented, pickled, vinegared, smoked, okay, processed meats, pepperoni, sausages. Cut that stuff out. Stick with fresh foods. Okay, don't eat leftovers from more than a day or two old. Fresh foods, fresh vegetables, other than those ones I mentioned. A couple other oddballs. Citrus can sometimes be a trigger for some folks. Okay, so you want to stick to a lot of times meat, veggies, and certain safe fruits on that front for him. Focus on stabilizing the mast cells. You can get quercetin. We have in chewable for kiddos. We've got different versions of that. That's great. They do really well with homeopathics. Okay, I know for mold we use a lot of times Celtropin, Sinus Defense, through EC3 and through Microbalance. Those are great for kiddos. Works really well to start balancing out. But also Citra Drops. They have a homeopathic nose spray. And if kiddos at 15 months are resistant to that, which they may be, you can spray it right in the mouth, right? And so it helps to clear that, helps to desensitize them a bit to do that. But you've also got to detox them, okay? So if you're already working on cleaning the house, detox them, stabilize the mast cells, remove the gasoline like histamine and inflammatory foods. That helps a ton, okay? See that consistently. Do we test for MCAS? And if so, how? Okay, multiple function. MCAS is a clinical diagnosis mostly because you have to, a lot of times, unless you're just raging with MCAS all the time, you have to test right in the window of when your histamine and your mast cells are flaring because otherwise the body clears it quickly. So you can do whole blood histamine. Okay, you can do a 24-hour urine histamine catch. You can measure blood tryptase, which is one of the things that histamine releases. Okay, there's a couple other markers you can measure. Those are the big ones for me. You can measure prostaglandins. Okay, you can measure histidine in the urine. That's a good one to measure. And then we do biofeedback testing in the room, in the clinic here at Keystone, the doctors and I do. So we can test for what's the sensitivity of mast cells, how's the body reacting to histamine and these other prostaglandins and leukotrienes and things like that. And so that's a big way we test. So we mix biofeedback, clinical diagnosis, and then sometimes these tests. I'll tell you the tests are hit or miss. They really are. Best one is really the whole blood histamine or the 24-hour urine histamine. It's the closest I've seen to be accurate consistently, okay, because the body's clearing it so much. But even then, I've had a guy, full body hives, and his whole blood histamine was like a 5, which is super low, okay? And it was like he was so flushing histamine all the time into the skin, it was not in the blood. And so it's hit or miss on these tests. It's a clinical diagnosis. We mix that with biofeedback testing and go from there. Our brain fog anxiety related to MCAS, yeah, we touched on this, right? So if your brain's inflamed and toxic, brain fog, mold toxicity, brain fog. But then you get all of these inflammatory guys, all this excess serotonin, all this excess histamine flaring. You're going to be anxious and brain foggy, no doubt. Just think about when you've got hay fever, right? You can't think. And so that's all that histamine up in that brain. What are the recommendations for their neurological symptoms of MCAS? Okay, so there's lots of herbs and nutrients that cross the blood-brain barrier to help stabilize inflammation and the mast cells in the brain. You can get quercetin, okay? I know Microbalance has a couple of histamine products. Some of the ingredients in there cross the blood-brain barrier. Skullcap's a good one that's antihistamine, cross the blood-brain barrier, stabilizes that on that front. But then really, gut-brain connection. I know we talk about it all the time in the functional world, but that gut-brain connection. So getting the gut-brain connection right helps to lower the brain load through that vagus nerve and then vagus nerve stimulation. But what else? Because we talked about stress, right? So whatever you can do to mitigate stress is going to be helpful. Adapt your environment as best you can. Learn to tap. We love tapping here. We do it. We do a lot of emotional work and tapping in the office. Do a lot of tapping. Work on the emotional side too of those neurological symptoms. And look, hey, there's no shame in saying sometimes if for a short period you have to do a pharmaceutical because this is just it's driving you insane, it's making you psychotic, because it will. No skin. Work on the natural root causes at the same time as supporting yourself in that front, if that's what you have to do to get through daily life, okay? Okay, Catherine says, does low iron make you more susceptible? Where'd she go there? Make you more susceptible to MCAS as iron helps the body detoxify. You do need iron to make the body detoxify. MCAS will a lot of times make you can get what's called chronic illness anemia, help you clear it out faster, and all the inflammation and histamine will force you to degrade some of the iron. Parasites will eat the iron, okay? And then also mold toxins will inhibit oxygen, which is iron bound, so that disrupts iron. And then we need iron to make all of our enzymes work. So all the enzymes, almost every enzyme in the body needs iron, okay, on some small level. And so, especially though the DAO, the HNMT, the MAOB that degrades histamine, we need iron. Okay, and so anemia in and of itself can be a big factor. Now, look, anemia is trickier. Just taking more iron might not do it. You might have to balance it out. A lot of times you need copper. You got to clear the parasites, or it's more of a B vitamin issue. So really make sure you're truly iron deficient before you go taking a bunch of iron, because that causes its own problems. Okay. How do you determine if it's mold illness or MCAS? Like I said, 98% of times MCAS is mold illness. Okay, it's what triggered it, and so a lot of times they're similar, but clinically you can differentiate the two. Okay, if you're having all the flushing, the histamine, the hives, those type of reactions, we know histamine and MCAS is involved. Okay, and so we know the mold is probably triggering that. But then on top of it, you can do a mycotoxin test for the urine. You can mold test your environment. We can do inflammatory blood tests to check and see, are you dealing with mold illness? Are you dealing with just MCAS, maybe triggered by bacteria or parasites, right? And so what is the link between hypermobility, MCAS, and what does that symptom often point to as mold as the trigger? A lot of people who are dealing with mold toxicity, we see this over and over in the literature, the research literature, and mast cell activation syndrome have hypermobility. Their joints are double jointed, right? They're hypermobile. They get injured all the time. They're spraining joints. Okay, maybe even going as far as having like EDS, Ehlers-Danlos syndrome. We saw with Michael Phelps, right? He had a version of that. And so the trigger is genetically they lay on the same chromosome. Okay, the genes that encode for the enzymes to make connective tissue strong, codes for a certain complement proteins in the immune system that makes you more sensitive to MCAS. Now, also constantly triggering mast cells, those histamines, those inflammatories, makes your ligaments looser, makes you more leaky, which makes you more hypermobile. Mold ramps up the enzymes like MMP9, which is an enzyme protein that can make you more hypermobile. Okay, it can imbalance collagen. It can imbalance TGF-beta, which affects connective tissue. Okay, and so then these people end up with like loose skin. They end up with hypermobile joints from that. And then you're more sensitive to it when you have EDS because your immune system is not connected, is not stable because of that. And all of these mast cells have to connect to the connective tissue in the extracellular matrix, which is weak with EDS. So they all link together as a family a lot of times. And I see a lot, not all, okay, but maybe half my MCAS patients are hypermobile since they were children, and their siblings or family members are hypermobile. And so it's a good way to look and see, is this maybe partially hereditary? Is there a way to know if my gut issues are SIBO or MCAS? Can they overlap? Yes. Small bacterial overgrowth or small intestine bacterial overgrowth or small intestine fungal overgrowth. We have too much bacteria, fungus in the upper digestive tract. That can trigger histamine because those bacteria will make histamine. Okay, the wrong bacteria will make more histamine in the gut, especially as they digest high histamine foods. They proliferate more histamine. And then how do you differentiate? We could do a SIBO test, right? We could do a breath test looking for hydrogen. We could look for methane. We could do a urine test. We're looking for those metabolites in the urine for the bacteria overgrowth and fungal overgrowth. We can see that's present. A lot of times you eat, you bloat. That's just a perfect sign of SIBO or SIFO right there. That's very easy, okay? Now, and then that can trigger mast cell activation like we talked about, okay? So that can be a trigger for mast cell activation. A lot of times, though, if you don't have the other clinical signs of mast cell activation, it may just be SIBO, okay, on that front. But you can also test for it. But they definitely overlap. They trigger each other, okay? And then because of the digestive imbalances, the mast cell causes inflammation, the bacteria overgrows, it becomes its own thing. We talked a little about sleep issues. Can high histamine cause sleep issues? Definitely, because it's overstimulating, disrupts your circadian balance. Is it possible for a 6-year-old to already be experiencing MCAS? We've battled allergies and asthma for several years and recently found out we have a large amount of mold in our house. Sorry to hear that. I know that's tough. In April, she got sick and the postnasal drip cough never went away. She seemed like we transitioned from a cold into severe allergies that haven't calmed down, and it's at almost 6 months. So any kid can have mast cell activation syndrome or histamine intolerance. Okay, it could be genetic, could be triggered. Maybe this one's triggered, let's say. A lot of my most intense mast cell cases, they know they've been more sensitive, histamine intolerant, more allergies since childhood. Okay, so that's maybe genetic, or maybe they were exposed to mold early on. They were born into a moldy house. So mold is an immunosuppressant. It imbalances the immune system, suppresses the immune system. So then we'll get a cold. Okay, your kiddos at school probably aren't picking up every virus and bacteria at school because they're all together. No, the school is probably moldy and all these kids are immunosuppressed. So your kiddo at 6 was probably immunosuppressed and they got this cold. And then because they got the cold, the immune system became overactivated with the inflammation and they could never kick it because the immune system couldn't kick it at that point. And so she transitioned from an immune activation event, getting a virus or a bacteria, immune activation event, into chronic inflammatory response, or MCAS. And so now it's continuing to perpetuate. That will probably perpetuate until the mold is taken care of in the house. So you tested the house, now it's time to remediate. You can also look at good factors like the EC3 mold fogger. If you can't remediate right away, can't get out right away, get the EC3 candles. They lower mycotoxins, they lower fungus. Start burning those in the house. Get the fogger if it's not too bad. If the mold overgrowth isn't terrible, get the fogger. It keeps the levels down. Okay, there's lots of things you can do to help limit your exposure. Start cleaning with the EC3 mold wipes, things like that, and then start this kiddo on eating detox of the mold. Start detoxifying now so the exposure doesn't make her worse. Or I don't know if it's a he or she. She. You said she. And so start detoxifying so it doesn't make them worse, and start dealing what we talked about with the histamine and the mast cell activation. You can look at the things that support it. Stinging nettle. Kids do great with that. Quercetin. Kids do great with that, okay? So look at that because this can really, really help on that front. The kids do really well at 6 years old with the nasal sprays. Really help keep those sinuses clear. Okay, so that's a big one. I know that's scary when the kiddos are sick. Okay, let me scroll through here. Yeah, EDS totally happens. I want to go back up. I know you asked earlier. So Dunlap, I want to go all the way up. I know you asked really early on. I told you I'd get to you. I'm not sure if I totally answered your question. So Dunlap was saying on this front, scrolling through, checking your message here. Such a great article. Thank you. I saw you ask a question, but I'm not seeing it now. There we go. How do we know if we're colonized? So what they're saying is, how do we know if we have like mold colonization or bacterial colonization of sinuses and gut tract? Well, you can do some of the tests, right? You can do a stool sample, you can do a urine test, you can do a breath test, see what's happening. You can do a nasal swab. Okay, you can do like a Marcon's or nasal swab test. Here's an off-label use. I don't know if Microbalance endorses this, but it's a Dr. Hart off-label use. It's fun experiment, okay? Not diagnostic, educational fun experiment. Take a sterile swab. Get all up in there, okay? Get all up in the sinuses and the nasal cavity. Swab. Take your EC3 mold plate, spin and wipe on that plate. Seal it up. Let it sit for 3 to 5 days. Take that bad boy out. Open it up. See what's growing on there. Had a case today, brought me back. She was growing aspergillus in the nose. Okay, you can see it on the mold plate. That's a great way to know if you're colonized. Look, at the end of the day, if you're dealing with mold exposure, almost undoubtedly you've got some level of colonization in there. You got to deal with the sinuses. Do the sinus rinses. Do the sinus sprays. Get it cleaned out. Okay, that's a biggie there. I've been treating those for months. Not a positive difference. Do I have mold, Lyme, autoimmunity, high candida? Maybe all of them. But I'll tell you, if you're still being exposed to mold, treating the sinus overgrowth is going to be difficult. And you may have to look at, do you have mast cell activation? If you have some of these other symptoms, you may look at that. This is just educational, but you might look at mast cell and needing to control the inflammation, dealing with the mold exposure and detoxing, and then cleaning the sinuses out. You may need that trifecta. Okay, that's that part. We call that investigative medicine here at Keystone. That's the key that the doctors and I function on, is investigate, see what's going on exactly for you in your particular case. I'm in that nasty spot right now. So sorry to hear that, Atomic Laughter, but hopefully you get a couple of cues to help you get out of that. Yep, allergic to stress can totally happen. Do you get rid of parasites before you treat mold? No. We covered this a lot. So Maya and anybody else, go watch the first 2 parasites, part 1 and part 2 at Microbalance on the Instagram. We talk about this. Parasites are there because they're symbiotic or because the opportunity's there. If you don't clear those first, the parasites will keep showing up and you'll create a ton of inflammation. Mold first. We're going to speak about the mold mast cell connection. We talked about the anxiety, totally. In your recommendations, liposomal and sodium ascorbate for vitamin C. We talked about the gliotoxins. Thanks for the question, Blair. Okay. What to do if you can't handle any supplements, full body rash after everything ingested? Number one, lower external exposures as best you can. Okay, learn external exposures as best you can. Start to regulate stress as best you can. Tapping, whatever else you can do as best you can. And then start homeopathically, very tiny, minuscule doses, even just rubbing it on the gums, rubbing it in the belly button to start because you absorb it better. Okay, on that front is a great way. So many of our patients and clients start hypersensitive like that. We got to start slow, work them through. We actually do a lot of frequency and energy medicine in the clinic to help them out so they can start to tolerate the supplements better. It works really well. If EDS is related to mold and MCAS, guys, we're just going to go over. You got great questions. So if you're on here, love it. We'll just keep going. If EDS is related to mold and MCAS, is EDS reversible? Acquired EDS is reversible. Okay, so if it's acquired, it's reversible. Genetic EDS is improvable. It's improvable. You can improve greatly if it's whether it's genetic or you acquire it from mold, MCAS, Lyme, parasites, wherever it's come from. You can improve it either way. Okay, but acquired EDS is reversible. Can you just eat a bunch of collagen-heavy food? It helps. It does. It helps. For some folks, it triggers histamine, but it helps rebuild it. Okay, but you got to deal with the root cause. Still got to deal with the root cause. Fun tidbit too from Catherine is that the plates do not grow bacteria. So if they culture stuff, it's definitely fungi and mold. Yeah, tons of mold in there. It's pretty neat to see grow. It's sometimes if it wasn't overwhelming, it'd be fun. It's a fun experiment to see what grows. And guys, check your cars. Cars are gross for mold. Really, really bad. Okay. High TGF beta. If you have high TGF beta, so TGF beta, guys, is part of the immune function. It deals with like fibrosis or like hardening of some of the tissues, especially connective tissues. It triggers autoimmunity. It's why mold can trigger autoimmune aspects. Applied a lot to MCAS. If you have high TGF beta, you will probably have recently been exposed to mold or are currently in an exposure. That's just the reality situation. Some things you can do when you have high TGF beta, anti-inflammatories, MCAS support, fish oil, SPMs, those are good. Where do we find you on Instagram? Dunlap, I'm at Keystone Total Health, Martin Hart DC, both of those we post all the time. We talk on. Microbalance helps us do a weekly live there as well on Keystone Total Health, Keystone-Total-Health. We do a live Instagram with Microbalance on different topics every week. I work with Microbalance quite regularly to do these lives, so you can find me here too doing this. It's great. Yeah, thank you for posting that. I really appreciate that. So, yeah, we do these all the time. Guys, I think I answered all the questions. I love doing this with you guys. Thanks for listening in. Thanks to Microbalance Health to have us, Dr. Martin Hart with Keystone Total Health. Multiple doctors here at the clinic helping people if you need help. Check out Microbalance and EC3's website for their products. We use them every day here personally in the clinic. We wouldn't use them if we didn't believe in them. Patients every day telling us how much they love the products and it helps them. Check them out because they make a huge difference. You guys, thank you. Take care. Share this. Like it when it's on. Comment when you got it because keep the conversation rolling. Take care, everybody.